Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we zero in on the Zika virus. Since the outbreak of the Zika virus in South America last April, there have been more questions than answers. Zika, which is transmitted by the Aedes aegypti mosquito, is classified by experts as a mild illness. But it has prompted significant concerns, especially for pregnant women, primarily because it has been linked to a birth defect called microcephaly. Babies with microcephaly have damaged brains and abnormally small heads. 3 pregnant women in Barbados are infected with Zika, but Dr. Juliet Skinner, the clinical director of the respected Barbados Fertility Clinic, strongly advises against panic.
We're very aware of the fact that with everything in the news right now, that of course someone who's pregnant is going to be concerned, okay? But I think it's trying to put that into perspective. And you know, one of the first and most important statements is, I don't think we know and understand Zika yet. And I think that right now there has been alarm raised in Brazil over an increase in microcephaly cases.
Dr. Skinner explains that microcephaly has been around for decades and is similar to other antenatal infections, including rubella and chickenpox, which also cause defects.
Microcephaly is linked with antenatal infection. Okay, that's been known for decades. CMV, toxoplasmosis, rubella, chickenpox. So let's take what we know about these infections, the timing of the infection risk and the percentage risk that if you get an infection that you actually have a baby with a congenital anomaly. And I think that again, this is information that is really important that a pregnant patient's being given this, because otherwise they think that one equals the other. It does not. That, you know, the data on chickenpox, for example, which I've said before, is, you know, the risk seems to be between 7 and 20 weeks. That risk is between 0.5 and 1% in the earlier part of that, up to the end of the first trimester, between 7 and 12. That if you were to get chickenpox in pregnancy, you could have a baby with an anomaly. Between 12 or 13, shall I say, and 20, that risk goes a little bit higher, up to about 2%. But really, really important for those poor patients right now that are pregnant, that 98 to 99% of women with confirmed infection of other types of infection that can cause brain anomalies have a perfectly healthy baby.
She insisted that mothers-to-be should not be made to feel as if they are doomed, even if they are infected with Zika.
Somebody who has been identified of having Zika in pregnancy is going to be managed slightly differently. So what that means is, for example, microcephaly is something that we can, in many cases, pick up on ultrasound. So that patient would therefore be monitored to a greater degree in pregnancy. And certainly, you know, to the point where, you know, we can look at brain anatomy in the attempt to try to establish that if there was evidence of microcephaly, that if it was recognized early enough, that patient can perhaps make a decision in the light of all evidence. You know, or that perhaps if this was felt to be improve an antenatal outcome, that it could be used in that way.
Dr. Skinner concedes the unfolding developments in Brazil are worrying. There, 460 cases of microcephaly have been confirmed, even as investigations continue into another 3,800 suspected cases. She, however, points out that a number of factors must be considered before a clear link is established with Zika.
There's the issue over vaccination that was implemented as a mandatory vaccine in 2014. There's also the issue about GM-modified mosquitoes that were basically released in 2012 and actually were not effective at their goal, which was to shorten the lifespan and control the mosquito population itself. Actually virtually did the opposite. And indeed, I saw a report from today as the analyses are continuing to be done and come through, that ultimately questioned that really and truly the microcephaly rise is not just last year. That whatever is going on in Brazil actually predates Zika by a considerable length of time. And the number that they used was actually 2012. There was some early reporting that now that, you know, this recognition's been made and that the funds and the activation of that response, which is first step medically to analyze and understand the cases of microcephaly in Brazil, that in fact the initial analysis is very much, you know, showing there are an awful lot of microcephaly cases that have absolutely no link with Zika whatsoever. So I think that the first thing is that for the pregnant patient with Zika, by no means are we at a point where we feel this is a confirmed link and risk, okay? This is a potential link and risk.
She added that the situation in Brazil and Barbados are very different and suggests that any outbreak of Zika will be reasonably short-lived. In the meantime, the doctor advises citizens to follow the precautions issued by health authorities, including wearing insect repellent and seriously reducing mosquito breeding.
Clean up your yard. The ministry is doing their bit. They're continuing to fog and continuing the fogging program, which can also reduce mosquito population substantially. I think there are going to be an awful lot more answers coming. And it'll be very interesting to see what the facts on Zika are in 6 months to a year's time.
That's Health Today. Join us again next week.